this is Dr. Joseph Ayala from San Diego Center for Integrative Medicine. Today I want to talk about healing and the inflammatory process. So I've been doing platelet-rich plasma injections now and now stem cells since 2009 and have noticed a lot of issues with healing. So the platelets are a healing process because they actually institute an inflammatory process. When platelets are used, the first thing they do is they release growth factors which are inflammatory, and those growth factors bring in white cells, which then release their own growth factors, which then bring in stem cells. This is a whole inflammatory process that's very important to any kind of healing when there's an injury. So I have people asking me when they're doing the platelet-rich plasma injections, what happened? Why don't I heal? Why didn't I heal? And that's a great question. And so I asked myself, why don't people heal? What happened to them along the ways? And I think there's several reasons. One of the first ones is maybe they are constantly re-injuring themselves. For example, they're a runner or a marathoner or some type of physical activity where they're not stopping that activity to give the body a chance to heal. I think that's significant. Secondly, maybe they aren't able to heal. Maybe they don't have the components in their body to heal. They don't have the vitamin C, the protein, the collagen, everything that's needed to actually do the healing. Third, maybe they smoke. When smokers smoke, they don't heal because they don't get oxygen into the tissues that are healing, which are the ligaments and tendons. And I've seen this where smokers don't heal as well as people who don't smoke. And finally, the last is, I think anti-inflammatories are a big problem. Everybody's told take an anti-inflammatory when they're injured, but if you think about it, if inflammation is the start of healing when you're injured, and now all of a sudden the body's trying to ramp up all this healing and all this inflammation, and you take an anti-inflammatory, you're literally cutting that inflammation off at the knees and you're stopping that inflammatory process, which is stopping the healing process. So I think that's a huge issue of why we have a lot of chronic injuries and a lot of chronic problems and chronic pain in joints that have gone on for months and years. And we need to stop using the anti-inflammatories in that way and use Tylenol, which is not anti-inflammatory. It's safe at lower doses. Ice it, rest it, and then if you need PRP, we can help you. So thank you very much for listening. This is Dr. Joseph Ayala again at San Diego Center for Integrative Medicine.